just don't want to be reaching out farther than you need to. I'm going to just quickly do a little side bending screen for him, and you guys can do this on each other, because if you find a little stiff spot, you'll have better outcomes. So I'm just starting up at like 2, 3. And just going straight side bending. He's generally a little tighter on the right. So nothing terrible, but maybe right in here there's a little something. Is that tender at all?
Mm-hmm.
Okay. All right. So if I want to go sort of toward his tightness, it's going to be a right rotation. Okay.
So he's tight
For this
on the
patient.
right.
Yeah, tight on the right. So I got my finger kind of on the facet that I'm going to be working on. So I'm going to do right rotation. So I'm just going to kind of start him with a little bit of right rotation. Okay, just preset right there. And then based on where this is, which is, I don't know, maybe 4 or 5, I'm going to have my thumb from the thrusting side kind of just on his mandible, or just a bit on the upper part of his mandible. Okay, so we're going to be going that way, so I'm going to just side bend him by using a shift. Okay, so you see what I mean by shift? I'm taking his whole head and I'm shifting it to the right, which creates the left side bend. You got me? I don't want to take the crown of his head out of midline, okay, because that just puts tension on arteries and brain stems and things like that. So we're going to keep the crown of his head in midline. I'm just going to do a shift to create that side bend. All right. So once I have that side bend, I'm going to shift my body, right? So now my toes are pointed kind of in the direction I'm going. And I'm going to just, again, check for tightness. I just had to do that because I thought if I kept bumping against it, it was going to like loosen up too much. So I'll show you that. So basically, I got the side shift, toes are pointed, and then I'm bumping up against that end range, and the manipulation is just here, right? Just like that, okay? The faster it is, the better it'll feel, all right? But it's just, you know, this hand, it's not like I'm driving it like this. It's both hands together, just here, okay? And it's a little bit kind of that way. It's a little bit in the direction that this thumb is pointed, this left thumb. It's a little bit in that direction, okay? But, I mean, what I hope you appreciated with that thrust was how short it was. I mean, it's super safe if it's that short. I'm just not doing any kind of stressful stuff on his collagen or his arteries and stuff like that. The reason it worked was because he had a nice barrier. You guys might not all have that, right? He had a nice barrier. And so, you know, once you're there, it's just, you know, it's almost like a hiccup. It's not a rotation. It's just like you're there, it's tight, and it's, you know, it's just like, you know, like, did that just happen? Okay. Yeah, I don't want to kind of over-talk this, because you guys are going to struggle with it. Who's done a cervical manipulation in the last month? Okay, good. All right. Yeah, I could talk and talk and talk. I don't want to. I want you guys to go do your thing.